Fentanyl, a synthetic opioid originally developed in the 1960s, was hailed as a medical breakthrough for its potency in managing severe pain, particularly in cancer patients and during surgeries. However, beneath its surface lies a complex and often misunderstood narrative, a drug that has evolved from a life-saving innovation to a harrowing public health crisis. Dr. Paul Janssen, a Belgian pharmacologist, developed fentanyl in 1960, recognizing the need for an opioid stronger than morphine, but with faster onset and shorter duration. It became widely used in operating rooms and as a patch for chronic pain management. In the medical community, fentanyl was celebrated for its precision, sparing patients prolonged suffering and reducing the burden of severe pain. By the 1990s, the opioid epidemic was gaining momentum in the United States, fueled by overprescription and aggressive marketing of painkillers like OxyContin. Fentanyl, being 50 to 100 times more potent than morphine, began to appear in illicit drug markets. Its high potency made it attractive to traffickers, as tiny quantities could produce large batches, maximizing profit margins. Drug cartels capitalized on this, mixing fentanyl with other substances like heroin, cocaine, and counterfeit pills. Users, often unaware of its presence, faced an increased risk of overdose. Fentanyl overdoses began to soar, marking the start of a deadly era. Today, fentanyl is a leading cause of drug-related deaths globally. The untold story lies in its victims, people from all walks of life. Unlike other drugs, fentanyl's potency leaves little room for error. A dose as small as 2 milligrams, the size of a few grains of salt, can be fatal. Families shattered by fentanyl often describe its impact as swift and unrelenting. Parents lose children to a single experimental pill. Recreational users fall victim to batches unknowingly laced with the drug. Communities grapple with the aftermath, from overcrowded morgues to strained public health systems. Much of the illicit fentanyl supply originates from clandestine labs, primarily in China, where its production is legal under certain circumstances. These labs ship precursor chemicals to Mexico, where cartels refine and distribute the drug worldwide. This transnational network has made fentanyl a lucrative and nearly unstoppable force in the illegal drug trade. The story takes another turn with the emergence of fentanyl analogs, slightly modified versions of the drug designed to skirt legal restrictions. Substances like carfentanil, originally intended as a veterinary tranquilizer for large animals, are now found on the streets, exponentially increasing the risk of overdose. Efforts to combat the fentanyl crisis are multifaceted. Governments are imposing stricter regulations on its production and distribution, while public health campaigns emphasize the importance of harm reduction. Naloxone, an opioid overdose reversal drug, has become a critical tool in saving lives, but it's a band-aid solution in a deeper crisis. Organizations advocate for supervised consumption sites and increased access to addiction treatment, aiming to reduce stigma and prevent fatalities. However, the challenge lies in addressing the root causes: addiction, mental health, and socioeconomic disparities. Fentanyl's untold story is a cautionary tale about innovation's double-edged sword. It reminds us of the unintended consequences of medical breakthroughs when they intersect with systemic vulnerabilities and human desperation. While fentanyl remains a critical tool in medicine, its dark side calls for vigilance, compassion, and an unwavering commitment to tackling addiction and its root causes. The fentanyl crisis is not just a public health issue, it is a societal one. It demands awareness, empathy, and bold action to address the factors that drive substance abuse. The untold story of fentanyl is not just about its dangers, it's a plea to rewrite the narrative, focusing on hope, recovery, and prevention.